Good afternoon, members, and to our members of the public who are here. We have before us Madam Secretary of Finance, Mrs. Tracy Norida. We also have our Special Assistant to the Office of Management and Budget, Mrs. Vicky Villagomez. And they are here also with their staff to assist this joint committee meeting this afternoon. We apologize for the slight delay, but at this time, the chair will now call today's joint committee into order. And at this time, if I can recognize Ms. Claire Sablon to roll call the members of the Standing Committee of Ways and Means.
Representative Ralph N. Yumo. Representative Danita Kaipat Yangetmai.
Ngangi.
Representative Patrick H. San Nicolas. Representative Malcolm J. Omar. Representative Julie Marie A. Ogo.
Present.
Representative Thomas John D.O.C. Manglonia. Representative Marissa R. Flores.
Present.
Representative Joseph A. Flores.
Present.
Representative Joel C. Camacho. Representative Angelo A. Camacho. Representative Roman C. Beneventi. Representative Vincent R. Aldon. Representative Roy A. Adda. Representative Blas Jonathan T. Atto.
Present.
Representative John Paul P. Sablon.
Present.
Chairman, you have 9 members present.
Thank you, Ms. Claire. With 9 members of the Standing Committee on Ways and Means present, we have duly established a quorum to conduct today's joint committee meeting. And at this time, I yield to Chairman Jude of Snyder.
Mr. Chairman, good afternoon, everyone that are here. Thank you for joining us this afternoon. This time, I also wish to recognize the members of the Senate, the Fiscal Affairs Committee, and the staff of the Legislative Bureau, and our office staff. And at this time, I recognize Devin Macaronas to call the roll of the Fiscal Affairs Committee meeting.
Senator Ronnie M. Calvo. Senator Manny Gregory T.
Can you use that mic, if you don't mind? The one. We're recording. This is a official meeting. So.
Senator Ronnie M. Calvo. Senator Manny Gregory T. Castro.
Stick out.
Senator Francisco Q. Cruz.
Here.
Senator Jude U. Hofschneider.
Thank you.
Senator Karina L. Magofnia.
Present.
Senator Donald M. Manglonia. Senator Paul A. Manglonia.
Here.
Mr. Chairman, 5 members are present and 2 members are absent.
With 5 members present, we have the requisite number to effectuate a quorum for the Senate. And I yield back to the chair.
Thank you, Chairman Jude of Snyder. And moving along in our order of business on today's agenda, we are now on item 3, adoption of the agenda. And do I hear a motion? There is a motion to adopt today's agenda, and it has been seconded. All those in favor, please say aye. Those opposed, say nay. The ayes have it. Motion is adopted. We are now on item 4, public comments. And at this time, the podium is open for any members of the public who wishes to make comments. The podium is open. Seeing that there is no public comments, therefore public comments is now closed. And we move further down on item 5, and that is the old business. And the old business on item A, with regards to the revised fiscal year 2026 budget that was submitted through communication from the administration to this legislature. So like the chair said, we want to thank you, Madam Secretary, and your team for coming before this joint committee, as well as Ms. V from OMB. So let me start with the pressing issues right now, Madam Secretary. I know that the pressing issues before us are with the issues with Chilai for the retirees, and also the 25% for the retirees. So my first question would be, Since October 1st to this day, how much already has been remitted for the 25% to the settlement fund for the retirees?
Thank you, Chairman, for that question. I have my staff here with me, which will be pulling up data as you requested, so if you could just give me a moment.
And while we're waiting for, let me just go a little bit back, Madam Secretary, my apologies. I was just informed that, do you have a PowerPoint that you wanted to provide the Joint Committee?
Yes, sir. I did bring a PowerPoint today. If you
Okay,
don't
so
mind, if we can
let's
put it up on the
go
screen.
ahead and receive that PowerPoint before we go into questions and answers. My apologies. Please proceed. You have the floor.
Thank you, Chair. Good afternoon, honorable members of this Joint Committee on Ways and Means and Fiscal Affairs. I am glad to be here with you today. Again, my name is Tracy Narita. I am the Secretary of Finance, and I'm here to push the governor's revised budget forward. The governor's budget has been remitted to this body since October 14. Sorry, I'm trying to work with your. There we go. Sorry again, I repeat, the governor's budget has been remitted to this body since October 14, over 50 days ago. It included a scenario with the MPLT loan and without the MPLT loan. On December 5th, the administration executed a loan agreement with MPLT facilitating this funding. This milestone makes the governor's proposal, Scenario 1, fully actionable. And I am urging this body for action on this pivotal decision addressing the group health and life insurance program. We have 3 options in front of us today, and I'd like to explore each with you. Option 1, on behalf of the governor, we fully support and urge you to act on option 1, which is to pass the governor's revised budget proposal that includes funding to secure this option. This option is the least disruptive to healthcare for employees and retirees of the central government and all autonomous agencies. We would like all current members of this plan to maintain their health insurance. Current enrollees will keep their coverage active and roll over to the new year. They will continue to fill their prescription medications. New enrollees who choose to opt into the plan will see their coverage retro back to January 1st once open enrollment is concluded and once they are active in the system. This is the best case scenario that the governor's revised budget proposal supports. Option 2, terminate and renegotiate the plan. This is what I call the nuclear option. GHLI will terminate the current plan as is and renegotiate with a new funding level. The piecemeal funding of $2.8 million for the retirees will not work. Aetna contracts for 12 months out when we negotiate an agreement. This option will only provide 4 months of funding for the plan. Again, this approach does not work as a new 12-month contract is needed with Aetna. This nuclear option will force our program into what is called a catastrophic plan. Premiums will increase because the government share goes down and the employee share goes up. This plan may also have a deductible as high as $10,000. This means that every employee enrolled into the health insurance plan will have to pay up to $10,000 out of pocket before using their health insurance. This option is expensive and useless for those who don't have $10,000 to spend. Thus, we expect members to fall out of the plan. Option 3, terminate the plan and seek a new provider. This option means that we will consider other companies that historically were not the lowest bidder. Thus, we can expect premiums again to be more expensive. Most importantly, CHCC, our lone hospital, has forecasted $16 million to be collected from Aetna in claims. This means that CHCC will lose revenues. We don't have money to fill this $16 million hole in our budget. So what's at stake? Over 7,000 lives are at stake. The loss of health insurance coverage for all these lives equals a health crisis. People undergoing treatment right now will be affected. People on prescription medication for diabetes, high blood pressure, kidney failure, pregnant mothers and children will all have their health care affected come January 1st. A high deductible plan will make this insurance unaffordable. Last but definitely not least, we must be mindful of the impact to CHCC and the revenue they depend on. Today, I extend the invitation to all members here and all interested parties to an executive meeting with Aetna so that all members of this committee and stakeholders are well informed of our current situation. My ultimate recommendation is to pass the governor's revised budget as submitted to avoid a healthcare crisis. Please act on the governor's request for an emergency session to pass the budget by December 15. The solution to this crisis is in your hands. Can we count on you to take immediate action? I believe so. We are in this together, so let's work together. Thank you.
Thank you, Madam Secretary. Ms. V, do you have any PowerPoint for the Joint Committee?
I don't, but I have a comment.
Please proceed your opening remarks.
Good afternoon, Chairman, members, and members of the public who are joining us here today. We stand at a critical juncture. The calendar tells us that there are 19 days left before the start of the second quarter. But in truth, there are only 11 working days remaining for this legislature to act. 11 days, that is all the time we have to prevent a crisis that will affect thousands of lives. The consequences will be severe. Like the Secretary of Finance emphasized, 7,000 people who rely on the most affordable health coverage for their medical care and prescriptions will lose access. Families will be left without the security knowing they can afford the medicine they need. Providers will face uncertainty, and our community will bear the burden of hardship that is preventable. Our hospital system who rely on these revenues will face financial strain, jeopardizing services and stability for the entire community. And beyond healthcare, government operations will be disrupted. Without a revised budget, agencies cannot plan, programs cannot be funded, and essential services risk interruption. The price of government has changed, and the urgency to act is necessary, and the public deserves to know why. This is not just about numbers on a page. This is about the lives of our people, our workforce, our health, and our dignity. We cannot allow delay to rob our people of the care they depend on. We call upon this legislature to act swiftly, to prioritize the budget revision, and to ensure that coverage and our government operations are not put at risk before the second quarter arrives. The truth is clear, the time is short, and the stakes are high. Let us not be remembered for inaction, but for leadership. Let us act now, because 7,000 lives are counting on us. Thank you.
Thank you, Ms. V. So let us now proceed with questions and answers. And do you have, Madam Secretary, the answer of my initial question?
Yes, Chairman, it's approximately 3.3. The 25% portion paid to date is 2.5 million.
Okay, 2.5 million, and this source of funding of 2.5 million are outside source, is that correct?
Yes, that's correct.
How many, what is the figure from OIA? And we know that we also have the 2.7 from the settlement from the courts with regards to Tim King. Can you break that down for the joint committee in totality?
So the 25% federal grant award that was received from OIA amounts to $2.166 and $600. So $2,166,600. That's the exact amount that was awarded. However, they are awarding on a monthly basis, and there is a delay in funding for the third month because they are still processing funding. However, they said that they will inform us as soon as this funding gets pushed out. We have requested that the funding they did release so far be prioritized to this allocation for the 25%, because there are other categories that were awarded in the 5.7 million grant, and only 2.7 has been transferred or approved to date, which goes to other categories such as the Munis system, the health network program, utilities, and corrections. And so we're asking that the 25% allocation be prioritized at this time while the funding is delayed. And then the breakdown of the 2.7 million coming from the casino GRT, that can be provided as well.
So thus far, your office had received from OIA already in a tune of 2.1 for the 25%, is that correct?
Can you give them
So to date, the Interior has awarded the Commonwealth $2.7,071,500. So 2.7 million has been awarded to date.
How much out of the 2.7 is dedicated to the 25%?
Out of the 2.7 million, we've requested that the funds for month two be shifted directly to focus on the retirees, because the need is immediate for the retirees to be able to meet the December 15 and the December 31 payment. So for month two, the allocation under OIA was only $1,083,000, but we've submitted a request to shift all of the month two award into the retirees, and we will get 2.1 million if that is approved.
So since October 1st, I guess my question would be, since October 1st to present, how much was already given to the 25% for the retirees to the settlement fund,
So-
OIA funds?
Okay, so for 1 month, the retirees did not get any allocation for the first initial month that was awarded to the Commonwealth. On month two, the allocation for the retirees that was dedicated was $1,083,300.
And that, you're talking about the month of November?
That's how they are processing awards to the Commonwealth, yes, for the month of November.
So we have, are we expecting the same tune of funding for the month of December?
We anticipate the month of December, the difference of the 5.7 less the 2.771 award, and that's what we anticipate to get. I think it's about 2.948 million.
Okay, so you mentioned, Ms. V, that for the first month, nothing was allocated. What source of funding did the administration use to fund the 25% for the retirees?
So the question was focused on the retirees. For the first month, zero was allocated for the retirees, but there was a $412,500 award that is directed to other activities within that.
Right.
Yeah.
So my question would be, what source of payment did the administration pay the 25% for the retirees for the month of October? Since the 412K wasn't dedicated for the 25%. Did you guys use the 2.7 from the settlement from the court?
Yes, the 2.7 in casino GRT, which is earmarked to the 25% payment, that was made for October 15, October 31st, and then beginning November 15 onward, it was coming from book to the OIA grant.
So for the month of October and the early part of November, using the 2.7, how much
Yes.
out of the 2.7 was used?
So we can give you a
Yeah.
fund certification for the casino GRT account. There has been a significant deficit that we found once we did the fund certification for the casino GRT, and this is coming from the JDE system when we were trying to update the account because the CGRT has not been used in a while, in a long time, until the bankruptcy was completed and the 2.7 was received. And we can provide that copy of the fund certification to this body. It is a drastic deficit that you will see our adjustments being made. And the explanation is there, and my office will provide that to you.
Let it be a request by this joint committee. We need that breakdown. And let me recognize on a follow-up.
Actually, not a
Vice-
follow-up, Chairman, but just a request that any request from this committee be given a timeline, as we know that we're already in December, and there's certain payments, so that whatever it is that you formulate, that please put a timeline on it, whether it be 1 week, 2 weeks, 3 weeks, but there has to be a concrete timeline. Thank you.
Thank you for that recommendation. If I may request that we can have this breakdown within a week of business.
Chairman, I can let you know right now that the fund certification is complete. We'll provide you a copy by end of day.
All right, thank you. Let me move to the GLHLI for the retirees and the negotiation that the administration is now negotiating with and how much of extension was given to the central government for this negotiation?
So our current agreement goes through December 31st, so there is no extension right now. The expiration is December 31st.
Did-
If you're talking about an extension in terms of open enrollment, the normal process is that open enrollment will begin in October so that there is no planned disruption or disruption to members or providers come January 1st. So the normal procedure is that we would already have the funding in the budget for us to allow open enrollment to begin October. 30 days after that, it closes for anyone that's making any changes to their plan or new enrollees or people that opt out. And then it would give Aetna time for the month of November and December to complete the final list of those who are covered and what kind of coverage you have come January 1st. So now we are actually late in that processing time. We have not started open enrollment because we cannot guarantee what the rates will be next year because we don't have the budget funds.
So did the administration request for any extension with the negotiation by any chance?
We did discuss what that would look like. However, without the funds to secure any extension, the current rate agreement will expire.
Meaning that if there is no funding by December 31st, is what you're saying that we don't have an insurance
That is correct.
coverage?
Yes, that is correct.
All right. Let me yield to the Vice Chair.
Thank you, Chairman. Secretary, good afternoon, and to your team, to OMB. Just a quick follow-up question on the 25%. What's the anticipated amount that's going to be received from OIA for the 25% for the month of December?
The anticipated amount for the month of December is $1,083,300. However, earlier I mentioned that
Yeah.
we had submitted a request to OIA to shift all of the allocation under month 2 towards the retirees because there is a delay in the December award, which is month 3.
And how's that negotiation going?
We submitted the request to OIA. We're just waiting for a response.
Okay, so the 2.7, how much is left of 2.7? Roughly $1.7 million?
For the 2.7, how much of it is going to go to the retirees?
No, how much is left? Because you used a portion of 2.7 in October, right?
Yes, so that will be provided in the fund certification to this
Okay.
body. Yes.
So if the letter to OIA is to push the money for the settlement fund, if there's money for the settlement fund, can we utilize the OIA money that's supposed to go to the 25%? Sorry, not the settlement fund, but the 25%. Can it reimburse other accounts?
No, the federal funds can only be used for the intended purpose.
Okay, but if it's delayed, right? And let's say the payout happens December 30, for example, and we use our portion of the 1.7 that's left from the 2.7, and then the money comes in.
Oh, yes.
Can we?
If we use local funds to address the 25%, the
That account
federal
can be
grant
reimbursed?
is reimbursable, yes.
Reimbursable?
For that purpose, yeah.
Okay, so the best case scenario is obviously we're gonna get the full amount for the
Yes.
fiscal year, right? So I guess the goal is to continuously run this account, the $2.7 million account, so that it can be backfilled, for lack of a better term, backfill in the future when we get the monies from OIA.
Yes,
Correct.
as long as we have an authorized source of funding, we will use that source for the 25% until it is depleted.
But even if it was depleted, it's still gonna be a live account because it's included in the current fiscal year,
Yes.
correct? Okay. All right. Thank you. And back to just to follow up on the group health life insurance. You had mentioned to the chairman that we need the budget allocation to open enrollment. Is that correct? Or for Aetna to say, okay, let's move on with the fiscal year?
Yes, actually, before we have an open enrollment, we execute a new rate agreement with Aetna, and that is based on the funding that we have available for those rates, right? What is going to be the premium that employees will pay, and what will the government pay? So right now, the only funding available that we have authorized is for the active employees share, government share, which is embedded in the current budget. So without additional funding, we are unable to determine what the premium would be for the new open enrollment. So how do we have open enrollment when people cannot decide whether they can afford it or not? So that's the importance of having a budget passed so we can begin open enrollment.
Okay, so a pre-filed legislation, because we already have an existing budget right now, right? A pre-filed legislation, would that trigger the opportunity to negotiate already?
Right now, all we need is the budget authorization, right? In order for me to execute a rate agreement and a contract, I would need to certify those funds. And you guys know that process because all contracts get routed to finance for fund certification. I cannot certify funds based on a pre-filed bill. I need the law to allow me to certify those funds. So that is why I'm saying that option 2 does not work right now, especially because option 2 indicates the 2.8 that was just passed by the House, and that is the piecemeal funding that I'm referring to, and that Aetna contracts 12 months out. So if I only get 2.8 million for retirees and 3 million for active employees, that's all I have to bring to the table. And so I have to spread that out between 12 months. So what does that mean? The government share goes down, employee share goes up. That's what the new open enrollment's gonna look like. So I cannot tell you right now what the premiums would look like for low option and high option and basic option, but it will go up drastically, which will make the plan unaffordable. People will drop out. And so, again, that's why I'm reiterating to this body that we must pass the governor's revised budget because it secures the entire amount for me to come to Aetna and say, let's sign this rate agreement everything's good to go. Premiums stay the way they are. Coverage is not interrupted.
I do understand that, but a pre-filed legislation is exactly the same as an anticipated collection, right? We're pre-filing anticipated collections.
Not exactly, because the forecast is included in the budget that has passed, right? Those are authorized collections. Those are authorized estimates that I can use to certify funds in the same way that I certify contracts for the duration of the fiscal year, as long as it's included in the budget. So I need that budget authorization. Public Law 24-14 mandates that I manage funds in a way that funds are certified before any public expenditure. So signing a rate agreement means that I have the budget authority to do so. Right now, I don't have that.
Sure, I understand that, but when the administration submits a budget to the legislature, that's based on anticipated collection, correct?
Yes, that's correct.
So a pre-filed legislation is based on anticipated collection at the same time. So if we pre-file the budget bill, would that allow you to trigger these negotiations? Because the $2.8 million is liquidated cash that the Secretary of Finance can transfer directly to, in this case, the Group Health Life Insurance, and in anticipation of passing the revised budget that includes the rest of the payment of anticipated collections, would justify the negotiations of the Secretary of Finance with the Group Health Life Insurance.
It does trigger negotiations, and that's why we are talking to Aetna right now with what's on the table, right? So they are aware that the 3.7 is there for actives and 2.8 is available for retirees. It does mean that our current rate agreement as is will be terminated, and we will have to go back and renegotiate what does 6 million look like, right? So that's option 2. That's, I'm trying to make it simplified for you to understand what are the options in front of me right now when I go to Aetna and try to negotiate something based on the pre-filed bill, the 2.8 for retirees and the 3 million for the actives. And that's the answer. Our current rate agreement will be terminated, and we have to come up with something new with the amount of funding that we have right now. So there's 2 options for this body, the 2.8 or the governor's proposal, which is the least disruptive. The question about whether the pre-filed bill is the same thing as the revenue forecast, I think that's a question for the legal counsel in terms of budget authorization. Does it carry the same legal weight as a budget authorization in a public law versus a pre-filed bill?
Well, I think if you break it down, we're receiving numbers directly from the administration, right? And that's the anticipated collection for the fiscal year. The $2.8 million, we can put that aside. That's liquidated cash. It's sitting in the Senate. The Senate passed that. The governor signs into law. That's liquid cash. It can be already upfront payment, right? When we pre-file the legislation, it triggers to notify the Group Health Life Insurance that this is the amount of money that's going to be dedicated, the additional amount of money to the Group Health Life Insurance that's going to be dedicated for payment within the fiscal year. The liquid cash is going to be transferable up front. So they already know that they have the money. All we're doing for the rest of the fiscal year is we're projecting that a portion of these collections, $7 million, $6 million, is going to be diverted to the Group Health Life Insurance. I think that in itself should state that we're already making the commitment to make the rest of the payment. The $2.8 million is liquid cash. What we have in the budget, in the current budget right now for current employees, are not collected yet, right? It's not fully paid to the Group Health Life Insurance. If the $2.8 million, that's different. That's already liquid cash. It's going to go directly to them. So if we pre-file the legislation based on anticipated collections for the rest of the fiscal year with the free-up money of, and I guess in this case, $29 million, that would allow the administration to be able to negotiate this contract agreement, knowing the fact that the legislature is coming up with the rest of the money for the Group Health Life Insurance. Right, so thank you. And
Let me recognize Representative Yumo on a follow-up on the line of questions.
Thank you, Chairman. Okay, so we explored the pre-file bill. What about a joint resolution from the House and Senate authorizing the negotiation of this group health life insurance.
Again, I would like to ask the legal counsel to advise on the authority to obligate funds based on a joint resolution versus a budget law. I think that's who
A
should
joint
give us the
resolution is the
answer.
same as a law. It's both houses would
But you said
authorize
to
a payment.
negotiate versus to obligate
Okay,
funds.
so to obligate,
Yeah, and I think
$3
maybe
million.
that would also conflict with the Public Law 24-14, where the Secretary of Finance is mandated to certify funds before entering into any contract. And so that joint resolution, I think, would conflict with that. How am I supposed to certify that contract in the same way that I certify any other contract that must have funds available in its account authorized by law? So again, this is new to me, to think about a joint resolution that would authorize funds for expenditure. If the legal counsel says that is valid, then I think we've entertained something new.
legal counsels.
My opinion that a joint resolution authorizing will not work. It's different from passing a revised budget. The revised budget will give authority to spend funds, and that will give the Secretary of Finance the authority to certify funds to negotiate any contract.
You still have the floor.
Okay,
Rabio.
so the first MAP payment to the retirees, was it made as of date?
The first MAP payment to the settlement fund,
Yes.
yes.
So
We are currently up to date with all MAP payments.
so if we, I guess we freed up about, I'm not sure what's the first MAP payment, $5 million, is that something like that, or 4 point something?
The total MAP payments made to date, according to the schedule that I have in front of me from my staff, is 3.3 million. The weekly payment is about 334,000.
Okay, so with the signing of the $29 million loan, that freed up that amount, correct?
Not necessarily freed up right now. If you're talking about cash versus budget, we actually just met with the settlement fund trustee Joyce Tang earlier, right before this hearing, and we did discuss what would be best for us in terms of the distribution of the $29 million loan from MPLT, because we did execute the entire
Yeah,
29
And
million.
I don't want to get through the Joyce Tang issue.
But I'm getting
Yeah.
there to answer your question is what happens to the first quarter? That's the question,
Right.
right? Because we've paid the first quarter with cash. And then we went out and got a $29 million loan, which covers the first quarter to the fourth quarter. So what would be acceptable, at least what was relayed to me, was that because our loan agreement with MPLT requires that the funds go directly to the settlement fund would then reimburse the funds that we paid for the first quarter back to the CNMI. And again, I would like to tie this back to the governor's proposal. In the governor's revised budget proposal, the MPLT $29 million is already there. It's already built in. So according to the governor's proposal, this reimbursement would then go to other priority obligations as identified in the governor's proposal. If those obligation amounts change in the eventual public law that comes out for the revised budget, then that's where those funds will go.
So which are, name one priority, I guess, aside from GLHI.
Okay, I was gonna say GHLI is the top priority.
Yeah, so
Other-
does the governor have the authority to go ahead and negotiate? We've experienced in the past where the administration would authorize certain payments to address urgent need, and then come back to the House and Senate and says, I've used 3.8, for example, to pay GLHI, so we can start negotiation, and then the House can start working on the appropriation bill and so forth. That way you don't dump the whole GLHI issue to this body that would not probably meet together and pass a bill by the end of this year. Each house has their own priorities. The last meeting that we had with the Senate, I believe the Senate wanted a full picture of the first quarter. So we can't force the Senate's hands to say, pass something, even if the House wanted to pass something. We can't force the Senate to react or act on something when they have their own, I guess, not priorities, but they have their own list of agenda that they want to get from the Department of Finance before addressing the revised budget. I'm not sure if that's correct, but I'm just assuming that that's what I understood from the last couple of meetings we had. So does the administration, I guess the governor, have the authority to authorize payments so that they can start addressing the issue right now? That's my question.
The only payments that we will make, I can say on the record, are those that are authorized by the budget to date. So there have been payments or obligations incurred to date because of the budget allotments that were issued October 1st, November 1st, and now we're just waiting for December. So the question was, does the governor have authority to make payments? Yes, he does, based on the budget that has passed. Now, what would be my recommendation for the reimbursement that comes from settlement fund once the loan proceeds are disbursed is to hold those funds until we have a revised budget, because that way I know where the cash is supposed to go to. And again, that's why we had planned for this situation when we revised the budget. We had two scenarios. What would happen in scenario one? Should we be successful, which we are, in securing the loan? So now that we have it, the budget is a plan. It's an expenditure plan for where these funds will go to. So when we do get the reimbursement, yes, that changes our cash situation. But again, the expenditures can only be incurred based on the budget.
Thank you, Secretary. I guess with the Planning and Budgeting Act, the governor has 25% to reprogram and 10% within its, I guess, department. So is there 3.8 or whatever that amount is that he can reprogram into the dollar account so that we can start a negotiation?
So the budget revision, if you look at that, there's really not enough there to reprogram because we are operating on austerity. Everyone else is at 70 hours. So if you look at that, the positions, the vacancies are removed. And that was, what was happening in FY 2025. With all the vacancies, there were lapses within the department, and those gave the governor some room to reprogram. But with FY 2026, with austerity, there's really nothing there to reprogram.
Just a follow-up before I recognize Representative Marisa Flores. Madam Secretary, excuse me, you mentioned that you have already spoke to the settlement fund, Ms. Joyce Tang, for that reimbursement of what's being paid already, since you guys have executed the 29 million loan with MPOT. When are you expecting that reimbursement?
We will get the reimbursement once the funds are disbursed from MPLT directly to the settlement fund.
For the first quarter?
For the first quarter. Once they receive that, it will be reimbursed back to the CNMI.
Thank you. Recognize Representative Marisa Flores.
Thank you, Chairman. Okay. So let's just go back to this number of 3.3 million, which was supposed to go to, or which probably went to the settlement fund. So when was your first payment made? And the reason why I'm asking this is because I'm following up from what Rep. Yuma was asking. When was the first payment made to the settlement fund?
And we're talking about the MAP payment. I have a schedule here that I believe was requested by this body, and we provided. It was for the week of October 3rd. That's the first of $334,615.38.
October 3rd, okay. And then when was your next one?
Then we have a schedule here for October 10, October 17, October 24, October 31st, November 7.
1, 2, 3, 4, 5, 6, 7,
It's
8.
a weekly payment of 334,615.38 all the way through to December 5th.
Okay, but in November, you made 2 payments, correct?
We have November
1, 2,
7,
3,
November
4.
14,
1, 2,
November
3, 4.
21st, November 28th. Again, it's a weekly payment.
I understand. So was there any time where you remitted 600 and some $1,000 and change?
So what I'm looking at is the invoice entry schedule. And sometimes Treasury will lump those together. I'm not sure, but it could be possible. I'm reading to you the invoice entry schedule based off of Munis.
Okay, so since you're looking at that and it's active and you can certify funds because you said from the casino it's already up to date and you can certify that. Can you put your monitor up on the screen?
I can provide the schedule that has been sent to me from the settlement fund on the receipt of those funds.
So you can't put what you're looking at up on the screen.
I'm not connected to your screen, but I can send it to your IT person.
No, we would just like to see what's on your screen.
Yes, you
because
will see
can-
it when I give you a copy of it, but I don't have a
My
connection.
question was, can we have access to what you're looking at on the screen? You said no because you're not hooked on. So if we hook you up, we could see it, correct?
Sure.
Okay.
June, do you have a connection?
So this $3.3 million that they're talking about, that now is freed up because the $29 million loan has been approved. Is that correct? All the money that you contributed to the CNMI fund, totaling $3.3 million, that's freed. It's freed up right now, right? It's
In budgetary terms, yes, that's freed
okay.
up.
Good. So in budgetary terms, it's freed up. But you mentioned to Rep. Yumo that you're going to prioritize certain payments or obligations to pay this, to use this money. Is that right?
Again, I represent it to this body that based on the governor's revised budget proposal, it already takes into account the loan disbursement to NMI Settlement Fund.
The
So
3
what
point-
that would mean, if I can finish, is that the reimbursement, according to the budget of the governor's revised budget, those funds are already allocated to other needs. And what I would do if the governor's budget was passed is to pay those obligations according to the governor's budget.
I understand.
However, I did also say that will change if the budget that actually passes by this body is different from the governor's revised budget. Hopefully
Thank
that's
you,
clear.
Madam Secretary, for pointing that out. As we know, you've presented 2 scenarios to us since the beginning of the fiscal year. And right now, it's even more desperate from the first time you were here, suggesting that we were in desperate times. So 3.3 million is freed up somehow. You guys now will decide. But if we then appropriate this, make the revisions and say $3.3 million will be used for this particular obligation, you're gonna pay it, correct? Because now you want us to tell you how to spend this 3.3.
No, actually, the governor's proposal already plans for this 3.3. It's embedded in his governor's proposal
Okay.
submitted on October
All right.
14. It doesn't somehow just come out of nowhere. We planned for this. We planned for the loan. We planned for where the proceeds would go to. It is in the governor's proposal. It's already allocated, and I'm saying that the actual cash when received can only be used based on the budget that's actually passed into law. Now, you have a revised budget in front of you as a proposed expenditure plan. What you pass into law, I must follow.
That's good. And we're looking at your October 14 scenario. So now that we know that where there's $3.3 million that's free, Chairman, I think that since the $3.3 million now is available because the loan passed, we need to make sure that we include that in the revised budget if any changes are to be made so that we can make sure that those funds are earmarked so that it's not being used for, let's say, hiring purposes when we don't even need to hire anymore. Thank you.
Right. Thank you. And at this time, I yield to Chairman Jute, as there are some members of the Senate that needs to ask questions.
Thank you, Chairman JP Sablana. I recognize Senator Cruz.
Thank you, Chairman. Secretary, you mentioned that the 3.3 million was already planned, submitted by the administration. this last year, April. Is that what you're talking about, or the new proposed revised, that
I'm referring to the revised budget.
the revised? You're not referring to the original submission, because if you're referring to the original, the administration did not put the 29. It was this body
We're referring
that.
to the revised budget that was
The
submitted
revised,
on
right?
October 14.
Okay, so we're talking about the 29 minimum annual payment, right? The $29 million loan.
Yes, sir.
Okay. It's very, very disturbing when you're saying that everything already lies on us. We've been waiting for that 29 million to be approved by MPLT. So the legislature cannot be blamed at all times. Every time there's a crisis, we're the blame. And I always hear a statement of working together. So we're working together. We cannot be blamed if the crisis arise, whether from the retiree side or from the general side, but rather let's work together, right? So I'm seeing a lot of issues that lacking here is collaboration. The House, we've been talking about $3.7 million the past few weeks before the House passed that into law. And I was thinking, when that press release came out, that they don't accept any partial payment for that new group health life insurance by Aetna. Your side could have been communicating with Aetna or Joy Stan whether partial payment is acceptable, so that this body will not proceed forward with that legislation. For me, that legislation, even though we entertain at the Senate, it's not going to do any good, because they won't accept any partial. They want full payment. That's correct, right? So I think collaboration, we need to be telling us also whether or not that's acceptable, so that we don't waste our time to pass appropriation that is not acceptable. We've been talking about a $3.7 million, and I think that 3.7 that's the late payment, right? That they passed, the late payment that was submitted last year and supposed to be 2025. That was the 3.7 million, and we have 4.9 million of lapses, and we have the 1 million that is not disbursed because, the NAP already in place. So if I calculate all this, that we have to take 25% out of those, the remaining is 7.2. Why we're not talking about those? We're talking about crisis and blaming the legislature. If you total that, that's $7.2 million. All those three categories that is still there. So I think we should be talking about only the 29 million and whatever that was mentioned earlier about free up the 3.4 million or 3.3 million. The rest will be distributed to whatever critical areas. But we have 7.2 million. There's another report that there is, and you were there when questioned whether that is just a figure or cash. So if it's cash, meaning it's still in the bank. I don't know what's detaining, who's responsible for certifying that fund. Because if that fund is gone, it's illegal. Somebody have to be responsible for that $4.9 million. So I think we should be talking about that too. And like I said, you total all those, 75% of all those three areas, it's 7.225 or more than that. But we have exactly 7.2 for that crisis you're talking about earlier. So I hope that that's been that your side will address that too, and because, and I think I am not against PSS. I'm supporting PSS, but they have to be responsible for their action. That could have been spent for the kids. Now they cannot take the whole 100%. We have to follow the Constitution that they can only get 25%. So like I said, we must continue to reach out on that and see where is that $4.9 million. I think we should be collaborating and not putting the pressure on us, because we see figure that is there, we will pass it. And I know everybody will agree to that. We'll pass it and resolve the problem, but If there's something that is not really sure, of course, it's holding back the process. Other than that, I think, I don't know if anyone here in this room will not agree to, to expedite the process of this revise. So, but we need transparency as well. As it was mentioned earlier, of information that could have been just provided to the legislature, so that we don't have to be asking those information, and it's right here and in front of us, so we can be able to guide us through of what we have. Thank you, Chairman.
Thank you, Senator Cruz. And before I recognize Senator Poe, Secretary and your team, thank you again. So I'm referencing your October 14 letter on the budget scenarios that you provided. But before I proceed, have we, with regards to the retirees' health insurance, have we delved into a scenario whereby we see which of the pensioners are qualified for Medicaid coverage and Medicare, for that matter?
Yes, we have.
Do we have any information with that you can share for the public?
This is
disposal?
actually an active discussion that we have with the trustee. This is one way that we've agreed will bring down the cost of our plan, is to have retirees that qualify for Medicare to transition to that. And we do have members who are currently active on Medicare that still are part of our current health plan, so they actually have both.
Yeah, if it'll definitely help, like maybe not today, but rather in the near future, to share that with the legislature without, of course, redacting the names, but at least the figures, so that we can better project forward with regards to with that. And before I recognize Ms. Velma, please note that Medicaid is already qualifying our people to front load the payment of referral. And you can qualify this with Mr. Cruz. Maybe next meeting we can bring in Mr. Cruz, because you know that's one of the biggest big ticket item also that we deal with in the government. So yeah, the Medicare coverage, I think it's critical that we really look in clearly, so that we can also help your office negotiate. Maybe Velma can articulate more on this. So I recognize Velma.
We had a meeting with the settlement fund, and they were discussing with us how they are making calls to their members who are Medicare eligible, to provide them more information regarding. We have since also asked Aetna to provide us information of the members that we have in the health insurance plan and who have Medicare, so that we can see where the gaps are, so I can provide that information to you guys. And that report we just received last week.
Yeah, I mean, I think
So it is something we're looking into.
Okay, and I appreciate that, and without digging deeper into it because of the lack of information still, but I think this is important that we continue discussion on this closely. And this time I recognize Senator Paul Manglonia.
Thank you, Mr. Chairman, and thank you for asking those last few questions, because actually I want to comment about that. But I'll just ask this one question and go back to the main discussion, and then go back to this issue. Who negotiates for the CNMI, government, the health insurance rate agreement?
We do it for the GHLI.
Oh, the finance, Secretary of Finance?
Yes.
Do you have somebody other than yourself, Secretary? Is there somebody that knows insurance that really can get down to the nitty-gritty stuff and ask the questions?
So I have with me today Ms. Velma Benaventi.
So
She's
it's
the program
Velma that's,
director. Yes, and she has been with GHLI for many years. So if you have questions about the nitty-gritty, she can answer.
Yeah, and I do have, because I actually met with the governor of Guam's special advisor on health policies about a month and a half ago. And in Guam, I found out that if you're 65 and above and you're retired, of course, you're covered by Medicare. Government of Guam actually writes a check to them, $180 every, they reimburse them for the whole cost of Medicare, because government of Guam encourages retirees to get Medicare coverage. So they reimburse them. Why? Because when you reach age 65 and you're retired, Aetna doesn't pay 80% of your health costs. It's Medicare. Aetna only covers 80% of that remaining 20%. So I think that it's not fair for the manamcos, right? For those retirees over 65 covered by Medicare to be charged $700 or $800 a month. And that's why I asked who's negotiating it. And Vilma, please, we have a lot of meetings ahead. Actually, I'm meeting with Medicaid and some people this tomorrow at 3:30. If you can be there, join us 2:30, because these are some of the discussions that we're having. It's just not fair. Government of Guam actually reimburses your deduction from Social Security if you are retired and 65. And so that's why my first question now then is, of that $7 million, right, that the government pays for group health life insurance is for the retirees, right? I'm hearing that $7 million is for the retirees, $3 million is for the active government employees?
Correct. The 7.2 million is for the retirees portion.
Right. And so I want to know how many of those retirees are 65 and above.
Okay, I can get you those numbers.
Do you think it's 50% or more?
I don't recall.
So are these questions, when you meet with Edna, are these asked or discussed? And
So the spreadsheet that I have that I did request from them has the breakdown that they just provided last week. So I can provide that to you.
okay, I appreciate, but I mean, they're discussed in the
Yeah,
in the
so
Edna rate agreement discussion.
So we brought this up and we've discussed it with Aetna because so retirees who have Medicare, right? Like you said, Medicare covers
80%.
part of their plan or their expenses, and then Aetna covers the rest. So they have they're linked directly into Medicare, Aetna, so that they make sure that the expenses are submitted. And so that is why we are going through this exercise with them to see, what retirees we need to reach out to and who is qualified. And the settlement fund as well is going through this exercise with retirees, talking to them about Medicare and do you have, that you qualify and.
Yeah, so anyway, I don't want to keep the discussion
Okay.
on this, because that's a separate, but again, 80% is covered for those 65 and above retirees. They're paying $180 per deduction, and they're paying $350, almost $400 for high option every deduction on their retirement check. So it's just not fair, and that's why I think we should discuss this. I actually have drafted a bill to introduce, to require the Secretary of Finance to provide the legislature in 6 months a study of the Guam self-insurance policy for their retirees and for their government employees to require. So Secretary, is 6 months enough based on your experience, Velma, in your discussions on the rate for insurance, enough for you guys to provide the legislature? It's actually a separate bill, but I might push to be included in this revised budget, that you have 6 months to tell us that you have evaluated the Guam health insurance policy for their employees and retirees, and recommend to us whether there's a significant savings if we follow Guam's structure, and compare it to Aetna, or give us another option. Because I know we're comfortable with Aetna. Everybody's happy, I think, with Aetna's coverage. But it seems to, let me ask you, what was the rate for Aetna last
last fiscal year, how much did we pay for government and for retirees?
Our rates actually that we have now are the same rates as last year.
So
So the
it's,
rate isn't going up.
So when you say, maybe how much did we pay total last year compared to this year?
I'm sorry, I don't have my,
Is there also 10 million, 7
Yes.
and 3 roughly?
yes.
So it's,
And that's why it's budgeted that way.
okay, so what about 5 years ago? Is the same rate?
I don't remember. I have all that information because I've provided it to
Yeah.
Mr. Demapan.
So pretty much whatever they throw at us, we just meet and we say, let's pay them, right? There's no negotiation, there's no.
We've gone to RFP. We went to RFP last year, and that is how they were selected. So
Oh, RFP, and how many submitted response? Only them?
4,
4?
yeah,
And
and they were the lowest bidder.
so maybe in that language, I'm going to ask that you review past RFPs and then make a best option for the legislature to consider for next fiscal year, so that we can have we can make informed decisions. I appreciate.
Okay.
Especially in light of what I just mentioned about the retirees and those qualified for Medicare, how they're treated in Guam, no? Okay, so I'm just gonna let that go there, Mr. Chairman. So let me just ask, I know the discussion earlier was to find a way to, because right now, I guess, what I'm feeling or I'm sensing is Monday is just around the corner, and the members feel like we have to pass a revised budget by Monday, right? That's the sentiment that I'm hearing from the members. So what they're asking maybe is there a way that we can put this issue on the group health life insurance behind us, and we'll give the legislature a little bit more time to make a good decision on the budget revision. That's what I'm sensing. So that's why they're talking about the 3.6 million and all of that. They're just trying to find a way to pay that thing, open the re-enrollment, and let's not get our retirees and government employees to worry, and don't give us till Monday. We were told yesterday till Monday. And I think we can pass by Monday, maybe if we work every day, but they're saying they need more information from planning and budget and finance, and I'm hearing this from weeks before, and they're saying they're trying to get more information. So Mr. Chairman and
Thank you.
the two chairmen here are saying, wow, we need to get those information and also pass a revised budget by Monday. So that's the only difference, I think. That's how, am I right or am I making sense?
Yeah.
I don't know. That's kind of my sentiment. That's how, that's why they're even talking about the $3.3 million, right? That you're saying is already spoken for, no? But I guess the question is just, can you find some money and pay that? And don't tell us that we absolutely have to pass by Monday, or else they're going to lose their insurance and right? And then Secretary, find the money. And
Thank you, Senator. That is exactly why we're here today. We're looking for that money.
Okay, so
And,
thank you. I keep quiet.
Thank you, but there really is urgency, Chairman.
Yes.
We're not here to assign blame. We're here to give you the reality of the situation. Again, I know that this is a very complex issue because the health insurance that we have has a lot of factors. Again, I'm extending that invitation if you need to meet with Aetna to ask all your questions on the details. But again, it's in your hands to act on this budget. The budget that was submitted on October 14, that's 50 days ago. Again, it's an expenditure plan. And if you have changed the plan, then I hope you have something in place so that we don't delay any further. The governor has submitted a letter to the presiding officers requesting for an emergency session by December 15 so that we can avoid this calamity to our health care. And on November 19, we did provide a breakdown, another presentation to the Senate on these other sources of funding that Senator Cruz did mention. You know, there's the 1 million from the MPLT remittance, the 4.9 from PSS, and the 3.7 that's already embedded in the governor's revised proposal. However, like I mentioned today, if we can pass the revised budget as is, which is at the $138 million level, not taking into consideration the additional 1 million from MPLT and the 4.9 from PSS, that's okay with us because it doesn't jeopardize the GHLI. GHLI is in the revised budget. If we can just work on that for now, we can avoid this calamity. I understand December 15 is Monday, but again, that's why the governor's requesting for an emergency session so that we can go back to Aetna, finish the rate agreement, have open enrollment, and have people continue their coverage January 1st.
Thank you, Secretary. And I want to just respectfully disagree with you that we should not worry about the 4.9 and the 1 million and the 3.7 because those are the figures that are born after the October 15 deadline. And also, for us in the legislature, we are mandated to appropriate the $29 million in anticipation of the 29 million loan, which we just got after the legislature took, together, 2 times over to pass 2 laws to consummate that. So, for all of us here and for the viewing public, it took that long for us to actually get to where we're at today. So we're of the opinion that there's going to be some displacement of the remaining $24 million because of the $29 million. And part of that is the 3.4 that we're talking about. That's a reimbursement. And I see Ms. V is nodding yes this way. So at least coming from the legislative side. So if we are to take into account what Senator Cruz was alluding to with regards to the other funding that has been certified by your office, and putting them all together to address the revised budget, wouldn't that be the best case scenario?
Of course, best case scenario is that this body acts on 144 million budget, right? But again, because we're asking for urgency and it is based on an expenditure plan, the governor's revised budget proposal provides an expenditure plan that includes GHLI for at least the 138.4 million. That is something that we need action on. But if you are to add on the 1 million and the 4.9 million from PSS, that brings it up to 144.3. Again, this presentation was provided to the Senate on November 19. The governor did communicate what he would prioritize with those additional funds. However, at this point in time, we are asking for passage of the revised budget.
That's pretty much understood. Okay, Mr. Chair, I would yield back for now. Or I think Senator Castro wants to offer some questions.
Thank you, Chairman. I just wanted to, just make a statement about insurance. I remember once upon a time when we were under Hawaii Pacific Medical Referral Insurance, at least the retirees, HPMR. So my dad was a retiree and I was going to school out in the States, and it was very difficult to get seen. Oftentimes that insurance, whatever insurance we had back then, and I believe it was then former Congressman Carl Regis, when he was at the retirement fund, that kind of worked with the administration for insurance. It may be other members later on as the retirement fund evolved. But, Aetna is a pretty good insurance provider. Whether you're in the Philippines, in Korea, whether you're in Japan, whether you're in the U.S. mainland. It's I think it benefits a lot of our population, which are not only our population on island, but our retirees, our students out there in the U.S. mainland. So I look forward to assisting in continuing with Aetna. Thank you.
Thank you, Senator Castro. Now, Chairman, I yield back to you.
Thank you, Chairman, and thank you, Senator Castro. Madam Secretary, I know with your remarks earlier, with the line of questions from members from the Senate and the House, I think it's important for all of us to understand here that although we understand that the GLHLI issue is outright of urgency at this moment of time, but this August body, this joint body also is concerned about the 25% for the retirees. And we all know that you repeatedly mentioned that the revised budget by the administration calls to address the GLHLI for the retirees, but it does not address the 25% for the retirees. So that is the issue here that this joint body also is looking at. I know that you guys made efforts in using outside sources to address the 25%, but at this point of time, on your opening statement, you have mentioned that there is perhaps a lot of uncertainty right now with the outside source. So what is the plan of the administration if we don't continue getting this outside source to address the 25%? I know that you guys have been working hard, looking for funds for the 25%, but if we don't get those funding from OIA, so where are we going to get those funding to continue those payments? And I know that you guys mentioned a lot about the revised, but the revised budget that was submitted by the administration is not a full whole budget. It does not entertain the 25% for the retirees. So I want to know what's the administration's plan, absent any continuation of outside source from OIA to entertain this source of funding.
Thank you, Chairman, for that question regarding the 25%. That is a very difficult issue, and it is a very sensitive issue that we all face. That is why we continue to fight for that funding with our federal partners. We've included that in our federal financial assistance request. That is why we've gotten the 2.1 million from OIA, because we've communicated just how important the 25% is. But like you said, if there's no federal funds that are coming down for that, what else do we have? I think at this point, the retirees deserve honesty from the leadership. And the honest truth is that it is very hard to fund the 25% when we are already in austerity. Current employees are at 70 hours, PSS is at 64 hours, and it's very hard right now. There's just no funds available. The governor's revised budget does ask for 100% reprogramming, and this reprogramming authority will allow the governor to respond to unforeseen emergencies. However, there has been an unrealistic expectation that the 100% reprogramming will cover the entire 25%. Like Ms. Vicky had mentioned earlier, the reprogramming authority is great. It's there because of emergencies. However, we don't expect enough lapses to cover $9 million for the 25%. And so the retirees' 25% requires new revenue. We need to identify new industries, new revenue generating legislation that will allow us to pay the full pension benefit. Like you can see, our priority right now and all our efforts is to secure the 75%. And like you said, it's been taking months just to get the 29 million. And I hope everyone can see, the viewing public can see just how hard it's been for both the executive and the legislative branch to secure 75%. So for the 25%, what's the plan? Well, of course, we go to the federal government and we ask for help. And we are getting help right now, but that help will not last long, right? We need to help ourselves. So we need to generate our own revenue. The other option, which I will call again another nuclear option, is to ask the current active employees to get an even bigger austerity. Are we willing to go down to 64 hours? Are we all willing to go down to 50 hours so we can fund the 25%? That is a very painful decision, and it's not one that I support. I have not made that recommendation to the governor because we must operate the government. We must finish our single audits. We must provide services. So again, unfortunately, the governor's revised budget indicates only $1 to allow reprogramming. Should we have lapses, we will prioritize the 25%. That we can commit to. However, we cannot commit beyond our revenue projection because there is no basis there. But should there be a new industry, such as the casino industry, any other industry, auto industry, then sure, we can start talking about legislation that can address the 25%. But then again, I say this wholeheartedly, that our retirees need honesty and transparency right now, and that's what I'm saying in my statement today.
So if we're understanding your statement clearly, Madam Secretary, even if this August body gives the governor 100% reprogramming authority, you will never fulfill
I will not say
the
never.
25%.
I will not say never. I say it will give us the opportunity, the flexibility to use whatever lapses that we find. We will redirect it to the 25%. However, in honesty and transparency, it is very hard to find lapses to cover $9 million for the remaining of the fiscal year to cover the 25%. When we had the NAP emergency, we tried to use the 25% reprogramming authority, and we could barely even fund 1 week of NAP benefits with the reprogramming authority. Our hands are tied, right? Not just with the percent of the reprogramming authority at 25%. That's why we're asking for 100% reprogramming. So whatever resources we have, we can shift it towards an emergency.
But are you able, is the administration able to pay the 25% if we give you guys the 100% reprogramming
Again, that
authority?
depends, Chairman. That depends on the
So you
lapses.
can guarantee the 25% for the retirees
I will
at this
not
point of
guarantee,
time?
but I can commit that we will use the 100%, sweep whatever lapses that we have, and address the 25% with whatever amount that we come up with.
Thank you. So noted. Recognize Representative Marisa Flores.
Thank you, Chairman. And yeah, there's a lot to go over. I'm just going to ask my colleagues right now before I start. Does anyone want to ask before I start going? Because I don't think I'm going to stop. So if anyone wants to ask before me, I'd like to yield my time before anyone else. I'm just putting it out there.
Please proceed.
Okay, thank you. All right. So, yeah, I get that. Thank you, Secretary and OMB and your team for being here. And I do understand that we have to be honest, let's all be honest about our current situation, including revenue. So one of my questions to you is, and I know that you had given the chairman a response that indicated that some of the questions that were already given to you prior to this meeting, some of them couldn't be answered. But you used numbers. We used, I'm not sure which one here you are responding to. So I'm going to ask the question, and then you can tell me whether or not that was part of your response on the email, okay? Then that way I can narrow down what questions I'd like to ask. Is that fine?
Yes.
Okay, are you okay? Do you need something? Okay. All right, so the first bullet is the governor's, what were the governor's reprogramming activities as of December 4, 2025 of 2026? Do you have that available to us?
Yes, we do have that. Let me just pull it up.
Sure, thank you. And then if you can pull that up on the screen, I don't know where the IT is, but if the IT can connect Miss Vicky, can I ask for a recess while that happens, Chairman? Can I ask for a recess while we hook up Miss Vicky so that she can put up active?
Short recess.
Thank you.
We are back on our joint committee meeting, and before we had that session, Representative Marisa Flores still has the floor.
Thank
Please
you,
proceed.
Chairman. And thank you, Ms. V, for making such an accommodation to my first question, which was the governor's reprogramming activities as of December 4 of 2026. So just so that we know and we're all on the right page, can you tell me what the object code for 61000 is?
That is personnel.
Personnel, okay. And then can you tell me what the object code for 6900 is?
That's for others.
And what can you spend on all others? Does that have to be approved by the Secretary of Finance?
So the budget, currently, how the budget is allocated is just between personnel and all others. So that's where the funds can go in and out.
Got you. Okay. So then can you just tell me what 64060 is under the object code?
Utilities.
Okay. All right. Thank you so much. So that has been the activity for the governor's reprogramming activities of December 4, 2025 of fiscal year 2026, correct? Okay.
It's from October 1, 2025 to December 5th,
Okay.
2025.
And because now that we can see that on record, I guess, may I suggest that you also provide that via email to either our fiscal analyst and the chairman, and then he can disperse that out to us. And so you mentioned utilities. Can you tell me what are the grants that qualify for indirect costs? Or I'm sorry, how many grants qualify for indirect costs based on OGM's status table of grant awards?
It would depend on the terms and conditions of the grant, whether they would allow indirect costs or not.
So you don't know the total number?
I don't have the information in front of me right now.
Okay. So how much is the total cost or forecast for fiscal year 2026 for the executive or the entire government for utilities? Do you know that? When they submitted, I mean, you have everyone's submission for utilities in totality. Is it more or less, more than 12 million, less than 12 million?
Can we get back to that so I can pull up the department request?
Okay. And so the reason why I'm asking is because part of the grants that allow for indirect costs, we are only budgeting sometimes zero, sometimes $1, sometimes nothing. But if we are asking from grants to cover indirect costs, or I'm sorry, utilities, then I like to know that number, because then we can also make the assumption that from that particular number, we can go ahead and start allocating money for indirect costs for utilities to be paid to CUC. Okay, thank you. So then, in the governor's revised budget for both scenario 1 and 2, are there any salary increases or to any employees included in the scenario, yes or no? Either scenario, yes or no?
No.
No salary increase in budget one, scenario 1 or scenario 2?
No.
Okay. Can you provide us then a can you provide us a balance of each cash account at the bank for, number 1, operations, obligations, and or aging account? Can you do that as it pertains to the general fund?
A cash account, I think that one, you need to direct that question to the Secretary of
Okay,
Finance.
Secretary of Finance, can you provide us a balance of each cash account at the bank for operations, obligations, and or aging account as it pertains to the general fund?
Yes, we can provide a bank balance. As of what date? Because that would require our reconciliation team to ensure we give you an accurate number.
Okay, I guess then, since we're hooked up over there, I wonder if we could bring you here and you can just give us a Munis transactional kind of history. Can you do that?
No, unfortunately, I don't have that available.
You don't have access?
No, I don't have that available. I don't have that kind of view that maybe would be most helpful
Okay.
if you're wanting to see
right.
cash
Okay.
bank balances. That's not how
Okay.
it's even provided to
All
me.
right, fine. So, Chairman, if you can request from the Secretary of Finance the cash balance of each account at the bank for operations, obligations, and/or aging account as it pertains to the general fund within a 1-week period, or whatever it is your discretion, but strong emphasis on the timeline.
Let it be at the request of the joint committee within a
Okay.
week.
Chairman, if I may ask from what date, so I can communicate that to Treasury and the Recon team?
Rep. Marisa, you have the floor.
I think in terms of providing dates, I'd like to have the chairman consult with our fiscal analyst so that we can determine the appropriate requests, so that he has some accuracy in the numbers, so that we can pass a fair and balanced budget as it pertains to the general fund.
Let me just go ahead and recognize our fiscal analysis, Mr. Dave Pons, so that we can get those pertaining dates requests.
As of November 30, 2025?
November 30.
Okay.
Thank you.
Thank you,
Please proceed.
Secretary. All right, as of December 4, 2025, can you state the total balance of public debt in the books or the statement of position of the primary government? Can you do that now?
Give me 1 second. My
Sure, no
team is
problem.
pulling up the information that we had provided to this body.
Okay.
We'll just be referring to that.
Thank you so much, I appreciate that.
I'm sorry, my team is pulling that up.
Okay.
This is number 10 on
Number 10.
the data that we provided.
Okay.
As of December 4, we don't have the statement of net position that is created in the audit process when we prepare our financial statements. So we don't have a draft of that ready for you. The last statement of net position is in our FY 2022 audited financial statements. And so we can provide you, and what was provided to you was the outstanding bonds
Okay.
that we have.
All right, so if you can, I mean, obviously, if it's number 10 in the email that you had responded to the chairman, then he already has that on record, is that right?
Yes.
Okay, thank you. So we'll go ahead and refer to that question and consider that answered, and then get back with our fiscal analyst so he can determine actual forecast or projected. So you mentioned something about OIA and asking OIA for some federal bailouts. I don't know what you want to call it, but OIA had submitted some assistance through grants, as mentioned in the last time we met, in fiscal year 2026. And the use of these funds, which I assume is being referred to on the October 14 revised budget, is that correct? On how you spend some of these OIA funds? October 14, 2025?
Can you specify what page or what you're referring to?
So you had asked OIA for some assistance, and OIA had mentioned that you are going to use some of these funding to attend to some of your priority areas. Is that correct? Okay.
If we're referring to the operations grant, the 5.7, yes.
Okay, so on your October 14 letter to us, or the governor's letter to us, he talks about priority funding areas. So the 5.7, you mentioned 1.5 million was used to the Department of Finance. Did you exhaust all that 1.5 million of the 5.7?
No, so in the letter on the priority areas, the 1.5 million for the Department of Finance, Information Technology, this is for our IT infrastructure. 1.5 is being proposed from the general fund. The OIA operations grant provides $624,900. The need that was provided to us from OIT was actually 2.5. So there is still a budgetary gap of 375,000.
Okay, thank you. And Chairman, for the record, pertaining to that question in regard to OIA total funding in fiscal year 2026, and the reference to that is the October 14 letter in which the governor emphasizes priority areas, and the secretary's response, if we can get that in a written letter form, the activity, the expenditure, the history of the money, how it was spent, and the current balance now, provided to the chairman and to the fiscal affairs, fiscal analyst. Chairman, is that okay?
Chairman, I believe that's a request that was already provided.
Already?
I
Okay,
think that's
wonderful.
what's provided. I believe
Got it.
my secretary had sent an electronic copy to each member.
And that's the 200 and some pages and 40 some pages. It's all kind of like all together. It's all there by PDF. I just want to make sure that I don't have to rewrite you a letter.
Well, the request from the Ways and Means, the Joint Committee,
Okay.
had a total of 13 requests.
Okay.
And this was one of them, so we did
Got you.
provide a copy of the OIA total actual funding in FY '26 and uses of these funds.
Okay.
It also asked to identify the types of expenditures incurred. That's what was provided.
Okay, and what number was that in the
That's
email that
number
you
two.
responded to?
Number 2.
Number 2, got it. Okay, I'm just making notes. Thank you. So, the other thing also, Chairman, that I wanted to ask the Secretary, and I don't know if this was something that you had already responded to in the email, it's in regard to the general ledger for each cash and cash equivalent accounts used to pay expenditures, obligations, collections, receivables, taxes, I mean, everything that has everything to do with the finances of the government as of December 4. Was that one of the questions, and was that answered in your email?
Yes, that was requested as number 4 in the request for information from this body. However, we have shared that request to the treasurer.
Okay.
This report is something that is prepared during the audit process again, and we are currently preparing for FY '23. So unfortunately, we don't have the resources right now to pull this data together for you in the audited form that it's being requested.
Okay. And sorry, go ahead.
So again, I have communicated to the leadership that right now we have been put on an escalated timeline to complete our FY '23 audit. And so all resources in terms of preparing financial statements for cash and cash equivalents is being directed to the FY '23 audit for completion.
Okay, and so can just keep it short and simple, Secretary, real quick. How are we going in terms of our audit? And when you say escalated timelines, like what does that look like? 3 months, 6 months?
Yes, thank you for that question. We had a visit from OIA last week from Deputy Assistant Secretary Angel Demapan, and he showed up in person to communicate to the governor that although the governor had issued an executive order for a expedited timeline for our 2023 all the way to 2025 audit with a 4 to 5 month turnaround time, that is not acceptable at this time, and that we need to push that up. We did let them know that it's a nearly impossible task. A normal audit is 9 months, and an aggressive timeline is 4 to 5 months. And now we are being asked actually to December 31st as the deadline, no later than February 2026. So they are basically giving us 60 days to complete something that takes 9 months. We have been given this impossible task, but it does not mean we will not try. And so, like I said, we are diverting all our resources to comply with this ask, or else we are jeopardizing all our TAP funding and all 85 projects that are currently funded by TAP. So
Okay.
we are under a lot of pressure, and
Okay.
like I said, anything on the list that's being asked of that relates to a audit statement. Unfortunately, we're not able to produce FY26 at this time because we're focusing on FY23.
That's not good news. Okay, so how many unbudgeted FTEs are currently anticipated to be filled? Anyone? Ms. Vicky?
Unbudgeted FTEs,
Yeah.
we've removed all of the FTEs in the revision.
Okay, so all the new hires were from FY 2025.
So whatever hiring that is occurring are the FTEs that remain. Either they were people have resigned, and those were replaced. But those are occurring within the revision, not within the authorization under Public Law 2414.
Okay, so it's still, you guys are still in compliance.
Yes, we are.
I just had to ask that, NTV. Thank you. Okay, the OIA letter, you guys have been talking, I know that you were in DC a couple months ago meeting with OIA, and you've mentioned repeatedly here that you have had dialogue with OIA and you had requested some supports, and you mentioned the word plan. So when you say plan, plan is different from a grant, or is that the same?
Can you please clarify the question as to what plan, because we're referring to different plans here. I did mention an expenditure plan, which is the governor's revised budget. However, is your question, can you clarify what plan you're referring to?
My plan is the anticipated external funds that you are asking OIA now to fund. Can we see a copy of that plan that you had submitted to OIA?
Yes, it's actually attached to the revised budget. It's an attachment of the budgetary gap. That's the only plan that we have provided in terms of addressing the budgetary gap. We've also worked on the fiscal reform. The Fiscal Reform Committee formulated the fiscal reform practices that were discussed by multiple subcommittees, including representatives from the legislature. That was submitted on November 30th. We can provide a copy of that table to you. It does include about 170-some rows of proposed policies for fiscal reform, and we'd be happy to share that.
Thank you. Chairman, for the record, if she could share that, please, with the committee.
Let that be an official request by the Joint Committee.
So back to the October 14, this is the fiscal plan that you're talking about that you had submitted to OIA, is just so that we're on the same page? Or that, is there something, am I missing something here?
No, that's a different thing. That's the budgetary gap. The budgetary gap table that we provided shows the critical needs and the request that we had given OIA to help address those critical needs.
Okay, so I noticed that on the priority funding areas, you have these little explanations that are very similar to a narrative, I would suppose, but it doesn't give us the breakdown of how you're going to use this money. So some of them are very straight to the point, like the 7.2 million for GHLI, the match, Northern Marianas College. And, and again, I have to, number 8 says the Department of Finance, 1.5 million, the Department of Corrections, but it doesn't give me, and again, when you're looking at this, you need to see, right, within the year, how much you anticipate to spend. So in 1 month, if I'm gonna go to DOC and they're asking for 1.7 million, and their short narrative says to ensure adequate medical care and inmate meals, I'd like to see what that breakdown is, because what if it would be less than 1.7 million and then there's extra money there that we appropriated and then we can't, appropriate it because now the governor has some expenditure authority, and now it's clear to us that you've stated he's now requesting and asking this body for 100% reprogramming authorization. So going back to your October 14 priority funding areas, Can you break that down in a kind of like obviously a form that shows us how much you'll be spending in a month or what your expenditure plan looks like? Because if you go to number 10 and you talk about government operations, fuel, communications, and supplies, you're allocating 1.3 million to provide necessary transportation, communications, and supplies to support administrative requirements. How many divisions are there in the government? Or, I'm sorry, the executive branch?
I don't have that count right now, but if you refer to Schedule A, it has a listing of all the departments and their divisions.
All right. So, again, right, that's just a lot. There's probably like 60 maybe. I would assume that it's right here. So I'd like to, honestly, I really like to see this because I know it's here for me to see. But based on your letter in October 14, that's different because this is now a revised. And this particular, these funds, if 35% of indirect costs, which we asked to get that number, and utilities are going to be indicated there, and it says that we have to pay utilities. Each agency or whatever grant says it's 12 million hypothetically, but I'm only allocating 1.3 million. Then there's 11 million there that's just nowhere. So I like to see that because I want to cross-check that with the qualified grants that can apply for the indirect costs. Is that okay? Can we see that?
Rep. Flores, I'd like to share a little bit of how we came up with the budgetary gap. Just because, yes, it is listed on the governor's narrative, which is his letter, cover letter to the legislature. And on page 2, we did list down the critical priorities that we are prioritizing in his budget. And these numbers just didn't come out of nowhere. It came from the department's request. So again, you called out utilities. Everybody requested utilities. But because we don't have enough for everybody, it's going to be put into one account and shared by all. You asked about Department of Finance, 1.5 million for the IT infrastructure. You can refer to OIT's budget request. You will see a breakdown of all the IT infrastructure that we actually need. For Department of Corrections, we are asking for 1.7 million. That will go towards the inmate food and medical care. Food is a necessary requirement for Department of Corrections. This 1.7 is needed so that we don't go into receivership, right? And we don't have a consent decree to tell us that we need to feed our prisoners. So again, if you need the detailed breakdown of these expenditure plans, they are in the department's request. And I am not an expert at these departments' needs, but they have explained their needs in their budget request. That was provided in the original submission on April 1st. Now, we cannot give the department their entire request. That's $246 million. We don't have that. We only have 144 million in totality. So again, we can't fund everything, but we did fund the most critical.
Okay, yes, and I'm very familiar that, with grants and what we need to satisfy, because if we don't satisfy it, we might get sued or we might have federal receivership, and then we'll have something like the settlement fund. So yes, we're very aware of what we need to pay. My problem is that when we have these expenditure authorities and then we only have assumptions for a budget, then we as a legislature need to ensure that whatever it is you're stating to me without numbers that I'm seeing, like actual cash in the bank or whatever it is that will indicate what these external funds are anticipated for us to see, then we cannot give and decide what is a fair and balanced budget. Yesterday, the governor put out a memo that now all federal FTEs are going back to 80 hours. Is that correct, Ms. Vicky? Or is it just CRM?
I believe it's just CRM.
Once again, but
Well, there is an exemption for quotas bus drivers. that runs 24/7, I believe.
Okay, and so those are not going to be considered as federal employees, knowing that we receive grants for them?
No, they are exempted. The
Okay.
bus drivers are.
So the bus drivers are full 80 hours also?
Yes.
How come, were they included in that memo, or do they have a separate memo?
Each department submits a request based on the need to continue to operate.
And then who approves that?
Everything goes to the governor.
So, Chairman, for the record, if we can get all those memos that would trigger the FTEs to be, federal FTEs to be at 80 hours, so that we know and we understand that these federal employees are also exempted and are fully funded under federal grants.
Let that be a request by the Joint Committee.
Okay, and then right now, I guess I'll yield my time and let everyone else ask. I want to formulate a little bit more based on the last, like, 5 other questions, but I'll yield my time and let my other colleagues ask questions. Thank you. Thank you, Secretary.
Thank you, Representative Marisa Flores. Madam Secretary, the source of revenue that was realized from last fiscal year at the tune of 3.7 million that was reported by the administration after the fiscal year ended, those are coming from the income taxes. Is that correct?
Most of them, yes.
So as of October 1st, the new fiscal year of 2026, how much in income taxes have finance received thus far to date on that source of funding or revenue or tax?
Are you asking for a revenue report on income taxes?
Right, the same source that you have reported of the 3.7 on the last fourth quarter of last fiscal year.
Okay, I think I just need to clarify that the 3.7 that was reported was on a cumulative revenue collection report that was part of the governor's revised budget. It is not coming from one single revenue source. It is the cumulative available across all categories. So can you please clarify your question?
Which one was the most out of all those accumulative source of taxes that derive from that 3.7?
On the attachment A of my letter to the governor, the cumulative revenue collections as of September 30, 2025, there's a column there for a percentage of total collection for that specific category. And there's some categories that are really high because it exceeded our projections, such as penalties and interest for delinquent taxes. That's 415% exceeded. 16% exceeded from business gross revenue tax. 289% for personal income tax. Overall, for the income tax category, that's 24%. Other taxes that include excise tax was negative 37%. So, of course, the 3.7 didn't come from there. License and fees went up by 5% across the board. So what I can provide for you is the same type of report that is provided on a quarterly basis. We can provide you for November 30.
Thank you. Let that be an official request by this joint body. Are there any members that have a question? Let me recognize Representative Yumo. Okay, you want to yield first to Mr. Dave Damapan? Did you have a question?
Madam Secretary, can we go back to the $3.7 million collection that was collected in FY 2025? Could you be able to give us the detailed breakdown of that total collection and indicated by what the actual cash receipts that they were transacted into? So we just want to know whether the $3.7 million were actually collected at the end of the fiscal year. If we can break that down and then give us the receipt date and the receipt number. because right now, both houses already, the Senate had already passed a legislation for the 3.7, and it's down already at the House. I think the House passed it. I want to make sure whether that revenue base is legal to be, to be budgeted for FY 2026 when the actual collection took place in FY 2025. Because when you look at it in perspective, that's actual cash. When we're looking for FY 2026, we're looking at projections or estimated revenues that are not yet realized as cash. So we want to make sure that that collection is considered a projection for 2026, if that's the case. Thank you, Mr. Chairman. Yeah.
Recognize the chair.
I think what Mr. Dimapan is referring to, I think it's still in the, just passed the House, no, correct, Chairman?
The 3.7 just passed the House. It's before the Senate. Just for clarification, I recognize Representative Rob Yumo.
Thank you, Chairman. Just follow up from the questions from Rep. Flores on under the reprogramming. I didn't see the total amount from the spreadsheet, Ms. V.
So,
Oh, no, she can.
no, that reprogramming, like how it reflected on the screen was directly out of Munis. And it didn't come with a total, but we can, because we are able to download it on Excel and we can just add it up.
Okay, so there's no amount from the total amount reprogram? The
The-
total amount?
The total amount, I mean, we can add it now. I mean, I can just go through it.
I just want to make sure that we're within the 35% threshold, right? Because the governor has 25% plus the 10% in his additional from these each departments, correct?
So the department has 10%, and if the request to reprogram funds is going to exceed the 10%, then we have to go to the governor for that.
Yeah,
Because
so,
the governor has that authority, but I think overall, I think the total reprogramming authority is just 25%.
So we haven't exceeded that yet.
No.
So can you say that there's 3.3 that the governor can reprogram?
The reprogramming that you see that you saw on the screen earlier is not even, I don't think it's even 100,000.
Yeah, so the governor has reprogramming authority to move at least $3 million to address GLHI right now.
Yes.
Okay. And then I know we didn't fund, I guess when the budget came in for this fiscal year, DOC didn't get any funding for food for the, I guess, the Department of Corrections. So how is that being funded right now? Is that part of the agency 10% moving around of funds to address the payment to feed the inmates and so forth?
So the current funding for the current contract, which is from July to, it's a 6 months contract, so DOC goes out for an RFP every 6 months. And that contract was executed at 770,000. But there is that March to June that has not been paid.
So it's a,
So that's a liability to the government because the inmates
so
have
that
been
would,
fed
so
already.
at the end of this fiscal or last fiscal year, there was additional funds there was fund balances, so that should have addressed and not come to the legislature for I guess, to reappropriation. At the end of the fiscal year, the Secretary of Finance reported X number of dollars available. So why didn't that one take care of the payment to DOC? If there's spending balances, so that means that I'm not sure, was it 3 point something? 1 point something, 1.3, 3.1? Yeah, okay. Anyways, I don't want to dwell on that, but we'll wait for the aging account to, did you ask that? Okay. Again, my last question, I guess, is And the reason why I'm asking this is because we have until the end of the month to find funds, and I want to ensure that I guess the employees and the retirees that the administration has that reprogram that they can use funds for now until this body revises the budget. I'm not sure with the schedule of the Senate. I'm not sure with the schedule of our chairman with regards to how to address the revised budget. But at least if we can get some commitment from both houses that put away the over $3 million to address GLHI so that we can at least get that thing going and not wait for the revised budget, because as you can see, a lot of the members are not on island, or some off island, and we need everybody back. So that's something that we can
So
discuss later.
currently with the governor's reprogramming authority, he has that 25%, up to 25%. If you look at the revision on the budget, there's barely anything to reprogram, and we're mindful that the authority of the governor is just within the executive branch. It does not include the legislative or the judicial branch. There's not sufficient funds to reprogram to cover the full amount of whatever is needed for GHLI. So, the best option right now, the best approach is to pass the budget as submitted by the governor on October 14.
Thank you. I yield.
Thank you, Representative Yumo. I recognize Senator Cruz.
Madam Secretary, in regards to the 3.7 you mentioned earlier, that it's a combination of different taxes collected?
Yes.
That one? Okay. I understand that the 3.7 was passed already by the House. Is there any anticipation on the same taxes within this 3.7? Or there's no anticipation?
The same taxes that were collected that went towards the 3.7 is the same type of taxes that are included in our current year revenue projection.
So that means there will be another 3.7?
No.
How's that? If you include that, then how do you say that it's the same?
If you look at schedule, the attachment A that shows the breakdown of the 3.7, it is a cumulative sweep of all the accounts that have more, some have less, but overall, when you reach the bottom line, that's the 3.7. And this same schedule here that we have for the revenues that we've collected is the same schedule that we use to forecast what we anticipate to collect. So I can't say that there's going to be a 3.7 until after the period has lapsed.
But what I'm trying to say is that one is cash, right?
Yes.
Right. So any in your side, any projection within the different taxes that coming in, that were paid that were submitted last year, that amount 3.7? Because if that's so, there's an additional anticipation, right? Supposed to be an additional anticipation, rather than just counting the 3.7 as part of the 2026.
I'm sorry, I don't understand your question. Can you clarify in
What
a
I'm
different
saying,
way?
that one is cash, right?
Yes.
So when we do projection, it's anticipation of what we're gonna collect, moving forward, because based on what we collected already, right?
Okay.
Right? So that 3.7 is collected. It's cash. So anything within the same category that you said, accumulation of different taxes, did you plug in any projection on those, or just you're basing yourself on that cash?
No, our projection for FY26 is not taking into account the 3.7. The basis of our revenue projection for 2026 actually went down, right? We adjusted the budget down from 179 down, now we're down to 158. So I cannot say that we're expecting a surplus or additional funds for this year. We've taken into account the state of the tourism industry. So again, it's very volatile, it's uncertain right now, but it's possible.
That's why I mentioned this because I remember a couple of times you guys mentioned that 3.7 is part of the 2026 projection. That's why I keep saying that, but it's already passed by the House. That means it's not
part of the projection. It's in addition to the resources that are available for appropriation. So on the last page of attachment B.
What I'm trying to say is, since that is paid, what I'm saying is, that from 3.7, are you projecting anything from those taxes that are accumulated and amounting to 3.7?
Yes, those same categories used that realize the 3.7.
So do you already project an amount?
Yes, our projection is the 158. It's using the same revenue categories that produce the 3.7 is again being used to project the 158.
That's what I'm asking. That's what I'm asking.
Okay, so yeah.
Are you back? Thank you.
Thank you, Senator Cruz. Madam Secretary, since the legislature branch have amended the cinema construction tax, have we received any revenue out of construction tax under the cinema statute, and are we anticipating? And what is the projection we're anticipating with all these construction activities from all these outside sources, from EDA, CDBG, DR, and all those funding? What are we expecting out of the cinema construction tax?
Thank you for that question, Chair. I have our Director for Revenue and Taxation with me. I know this is an ongoing conversation and an area that we could have revenue generation. So I'll pass it over to him to talk about the construction tax and how that's going.
Please proceed, Director.
So how it looks, I can't say what we're predicting or projecting as far as construction tax collections go. I don't have all the information on the contracts and the payment methods, payment terms, when they're going to receive payments and when the taxes are supposed to be paid. So I can't predict on what the revenue would look like on collecting the construction taxes.
So can you walk us through this joint committee? How do you guys intend to implement these taxes? Like, do you require these construction firms to report to you guys that there's a construction project that's going to be constructed up? And how do you guys gauge this businesses?
Well, the construction tax forms that we developed is where we're going to gather all the information on what projects are happening currently. So it's going to be self-reporting. The construction companies would have to report what their project is, the timeline, the cost on these tax returns. So that's how we're going to acquire the information. We can get other information from third-party sources, such as other agencies. But for the most part, it's going to be voluntary.
Voluntarily?
Yes.
So your enforcement task force don't go out and check, or there's no such requirement under this statute that requires these guys to report?
Yes, there is a
finance?
There is a requirement. These construction companies are required to report their revenue and pay their taxes.
How many construction firms have been reporting thus far, since we amended the cinema construction tax that is actually recommended by finance to amend?
I don't have that information on me, but I can get that information for you.
Let that be an official request by this joint body. Are there any other recognized?
Mr. Chairman, can I please add on to that? Because
Please.
I can hear your questioning on the term voluntary. I think it's worth noting that our entire tax structure is built on a framework of voluntary compliance. That is how all taxpayers report to the Division of Revenue and Taxation. That is how we collect taxes on an individual filing their 1040, a business filing their BGRT. They have to voluntarily report their revenues and pay their taxes according to the tax law. And if they don't, then that's where enforcement kicks in. So we can't go to a business and force them to file something that they don't have. So again, that's just the
So
structure of our tax system.
the CNMI construction tax says that construction firm volunteers to
It
report?
doesn't say that it doesn't say technically.
I think
but
it
that's just the
mandates them to
structure.
report, right?
Yes,
I don't
exactly.
think the CNMI construction tax says that you can volunteer to report. I think they're mandated to report. It's a statute, it's a law.
Okay. I'm just saying they are held to the same standard as all businesses when reporting business gross revenue. At the same time, they need to also report their construction tax.
Right, and if they
Yes.
don't report, then enforcement action should be taken, right?
Yes.
Yeah, but I think the law requires them to report. Representative Marisa Flores.
And thank you, Chairman. I want to follow up on that. And so the Secretary of Finance has all the information through its divisions, including commerce, including all these places where each business, each tax ID, you have all of this information. So at some point, if you really wanted to do that, the Secretary of Finance has more powers than the AG because you can subpoena them to say, hey, I like to see what you guys have been paying just to make sure, because you are identified here as a subcontractor of blah, 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 blah. Correct? You can do that, right?
Again, we are bound to the taxpayers'
Okay.
rights.
Yes, you do have,
and
they have
due
rights, but
process. And so there is a lot of authority in the tax code for tax enforcement. Yes, that's correct. But there are also limitations on how we can enforce taxes, again, for fairness, right, and integrity of the tax system. And I'll defer to our director on that process. So the way that we set up the construction tax forms is the same way we've developed the BGRT tax forms, because taxpayers have rights. And so, yes, we do have enforcement powers, but we are limited to what's allowed in the tax code and guided by the law.
right, okay, and thank you. And again, I'm just pointing it out there that you do have subpoena power, so does zoning, except for the AG. So you all can figure that out and maybe go back and talk to each other about how you would like to move forward and collect these funds, because you can ask them. It doesn't have to be I mean, they can volunteer, great, yeah, they have rights, but so does the CNMI government and our taxpayers. We have rights too, we have rights to collect, period. So go back and talk, because you do have the right to ask them, and then if they don't want to comply, then you subpoena them, right? But
Actually,
you
we have a collection process, so that's what the collection branch at DRT handles. And every taxpayer is entitled to a notice, right, of their balances, their tax obligations. They are given a timeline to respond, and so we fall into that process for collection. So it's
Right.
not as easy as having a list of contractors and then showing up to their front door and saying, hey, you owe this. They actually have rights where we have to serve them a notice of collection. I think a lot of people know what we're talking about, because thousands of letters have gone out. There's due process here for them to receive that notice, give them 30 days. They have the option to get on an installment plan. I think a lot of business owners know this process.
Yeah.
It's just that this is a new tax. We've had outreach sessions to provide information. That's just the nature of our tax system.
Okay, and that's wonderful, and I
Just trying
get
to
it, I
manage
understand.
expectations here in terms of actually collecting these
Great,
funds.
okay, and then again, we're not here to micromanage, we're just trying to offer, at some point, it was there, and it's there now, and you guys need to figure out how to collect that, because there is a lot of activity happening. In fact, there's so many construction activities happening soon, have been happening. So you all need to figure that out and work together. Because really, at some point, we talk about revenue generating bills, and we've been trying to do that, and then we get this response that we cannot collect because something happened. It's okay. I'm not even going to get into that. Just please work together and try to figure out how you can enforce that. So in terms of collection and forecast accuracy, Madam Secretary, how does the actual year-to-date revenue collections compare to your most recent fiscal 2026 revenue forecast, which is on your revised budget? Are we ahead, behind, or on target, and by how much?
This is actually a report that's mandated in the current budget law to be provided on a quarterly. So we prepare it on a quarterly basis. However, I think that there has been a request to provide it as of December 4. Our system is built to pull the data on a monthly basis. So we could pull it as of October 1st, November 30, October 31. But again, our reports are built so that it's on a quarterly basis because that has been the practice for the legislature. But I believe my staff have prepared a monthly collection report that shows the projections versus actuals. I think that was provided.
Okay, so are we ahead, behind, on target?
I don't have the entire package in front of me, but if you can refer to what we submitted, it will be part of that report that was requested.
Is it in dollar amounts and percentages, or is it a yes, we're ahead, or yes, we're on track, or what is it? I haven't read it because we just got it. When did we get that response? Today?
Yeah, it's been compiled by my team. Like I said, there was 13 different requests that had multiple sub-requests. So it's actually on number 9, revenue projections by quarter. I'm sorry, I have tasked my team to prepare that and provide that to you. I'm sure it's in dollar signs and percentages.
Good. So that was already answered in the chairman's letter to you, and you had an official response on the email? Or no, you're going to give us that later?
It is provided with the rest of the
All right.
documents.
So I guess Chairman will give that to the fiscal analyst to go ahead and look at those numbers. So in terms of austerity measures and executive directives, the governor and the department have issued several austerity directives. Can you identify exactly how much in real verifiable savings those directives have produced to date?
Actually, we calculated the anticipated savings in the fiscal reform plan that we have provided to Office of Insular Affairs. This is something that they are also tracking with us. And so we can, again, that number will be part of the fiscal reform table that we will be providing you a copy.
Okay, and did we say when you were did we even ask a request date to when you can provide that to us? I'm sure since it's already been submitted, you can provide it to us like tomorrow or something.
We'll compile all the requests from today and provide it to you as soon as possible.
Thank you. So have all required financial reports, including monthly revenue reports, cash flow statements, and fund status updates, have they been submitted to the legislature on time, or do we need to continue to ask for any of those moving forward? I'm just asking so that as we prepare to meet again, when we ask you, will you be updated?
Yes, I believe my team especially, have been trying our best to provide all the reports and data and information that has been asked of us in every hearing since October 14. We met with the Joint Committee on October 22nd. We met with the Senate on November 19, and these are multiple, sometimes duplicate requests that are being asked of my team. And like I mentioned earlier, we are going to go on a blackout to try and achieve this single audit by February. And so I'm hoping, Mr. Chairman, that what we provide you today or in the next week, based on the requests that have been submitted to us last week and maybe today, I'm hoping that that will be sufficient enough for the members to make a decision on the budget, because we have to pivot our resources towards the FY 2023 audit. So Rep. Marissa, I respect the request that you are asking of us, but I'm giving you the reality that it's going to be very hard for us to have that turnaround when we are pivoting resources to the audit at this time. So I respectfully ask for your consideration.
Thank you, Secretary. And yes, we do understand, but you must also understand that just as you have a function, so do we. And our job is to pass at least a fair and balanced budget that affects everybody. So we need to, as you mentioned, work together. But I'm pretty sure you got a system there that should provide us some data. Whether you put it on your letterhead and say unaudited, that'll be great. But it needs to be recorded at some point, because getting these Excel spreadsheets are not going to work anymore. We would like to request that anything moving forward in terms of what we're asking today would be actual printout of the Munis systems generation and not an Excel spreadsheet. And if you can indicate whether it's unaudited or audited, pending approval from the auditor, even better. But at the same time, we have to do our due diligence too. I mean, I know that what you're asking us is to push the governor's agenda, and yes, we want to work together, but we cannot continue to just keep passing budget with a projection and no actual numbers to know what's in the bank, what is liquid cash, what are our obligations. You know, we already know what our unfunded liability is. That's 29 million to the retirement. That's right off the bat, we know that. So here's my last question to you. And I think it's really important for me to ask, because I keep asking myself, you know, how did we get here, and why is it just like this? And there's so many external factors. There's so many areas. But you are the Secretary of Finance, and you have a big job and a task, and you took an oath. What is the single greatest financial threat facing the Commonwealth over the next 6 to 12 months? And what immediate action do you recommend the legislature take? And please don't go back to the governor's budget. I want to hear in your professional judgment and opinion as a Secretary of Finance who is in charge of forecasting revenue, collections, taking collections. I don't want to hear it from the governor's revised budget. I want to hear it directly from you as in your professional capacity.
Well, that's a loaded question. Thank you for allowing me to give my personal opinion, but also I'd like to give my professional opinion as well. And you asked for a single most dire situation that's threatening the Commonwealth at this point. And I'd like to say it is the GHLI. As a mother of 3 children who use our health insurance for their school checkups every year, as a mother that has used that same coverage during my pregnancies with my children, as a daughter whose parents use Aetna for their health coverage, I can tell you that GHLI is a top threat to the CNMI right now. There are 7,000 lives, real lives, that are using this coverage. There are people referred to the Philippines, Taiwan, wherever they may be, and they are there with the assumption that they will have coverage for their medical needs until they return. What will happen if they are still in the hospital on January 1st and they have no coverage? How will they leave and be discharged from the hospital? Those are the things that I think of. I have staff that rely on diabetes medication and all other high blood pressure, all these illnesses that plague our people. And if they have to start paying out of pocket my staff will have to pay $400 for every refill of his medication. And I worry about him. I worry about those people that are off island that may not be able to come home because they won't be able to pay their medical bill to get discharged.
Okay.
That is the single most dire need right now for the CNMI. And so if I may ask, I'm sorry, but I will go back to passing the governor's budget so we can avoid the healthcare crisis. So as a mother who uses the coverage for my children, that is also something that I ask. So thank you for giving me the opportunity to share that.
And that's great. You know, I empathize. I think everybody in this room can agree that the GHLI is the most important. I think there's other ways where we can improve. And luckily, the health chairman is here, and I know that he's been working really hard with CHCC. We have our other chairman who's away discussing Medicaid issues and Medicare issues that pertain to the CNMI government. But just again for the record, Ms. V, 3.3 or is it 3.7 million that's free right now that we can allocate or authorize to use right now?
The 3.3 in the governor's revision, it is embedded in the governor's revision, so it is allocated towards all of those lists in the list of departments and agencies, the budgetary gap, insurance,
Okay.
whatever's there in the budget revision scenario 1.
Okay. Yeah, I get it. And so this other 3.3 million that you're expecting reimbursements from the settlement is also 3.3 million. So where's that money gonna go?
It is already dictated in the budget revision where those funds are going to go.
So this remittance of the 3.3 million in which you had already paid to CNMI fund from October, you included in the revised budget?
Yes.
And your revised budget, she said that, Secretary of Finance said the first payment was in October 1st or October 3rd, right? Your revised budget was dated October 14. So, $334,615.38 was remitted on October 3rd. You claim that the revised budget's it's already been included, but you were already paying forward already weekly, which we know because we went to a meeting in which we saw your weekly or bi-weekly payments to the retirement. So how could it be incorporated when you guys were already paying prior to your budget revision? What money were you using?
The funds that we were using was based on the appropriation under Public Law 2414. When we did the budget revision, we removed the 29 million and reallocated. We anticipated that the 29 million was going to come through, pull through, and then everything else, which is the residual of the 29 million, is distributed to the budgetary gap.
Okay, so here's my last question. In terms of revenue, how much revenue and external funds are you set to receive between now and January? Besides OIA.
It would be federal programs, federal grant awards that we would, that the cinema has applied for and it is awarded for if the award is approved, or if the grant proposal is approved and awarded to the cinema. Those are the external funds that we would receive.
Nothing from the Office of Grants Management you've got awards already that have been down the pipeline. Some of them are extended. Some of them are still at the level of even 0.5%, 18%. So as they draw down, obviously you're going to get some funds. I guess what I'm asking is, within all of these grants that have been applied and have been awarded, and the grant amount is a significant amount. I think it totals about 108 million, if I'm not mistaken. Based on what I'm seeing here, and the actuals that we've actually spent out of the 108 million is only $39 million. So we still have remaining balance in totality of $65 million. Are any of these funds expected to come into the Commonwealth out of the 65 million?
So there is that performance period if the project is awarded and if there is an expenditure within the fiscal year, then yes, those funds will come in.
Do you have the anticipated number?
I don't have that information because I am not the program manager that executes those projects to push out. But if we're talking about indirect costs is already embedded as part of the revenue proposal.
Okay, well, I'm just looking at funds. I'm looking at actual monies that can come in. So I guess that we'll leave that for a separate meeting. But just for the record, Chairman, we did ask this body or the Secretary and OMB to produce very important information in regard to revenue. So please, we did set some strict timelines, and I'm hoping that they can abide to that, given, the scenarios in which they are facing. But also, if we're here to work together, we also have a scenario that we have to face. We have to pass this budget as soon as possible. And then you would continue to have these meetings with us. Thank you, Chairman. Thank you.
Thank you, Representative Marisa Flores. The chair will now yield to Chairman Jude Snyder.
Thank you, Mr. Chairman. And shift gear here a little bit, Madam Secretary. I know we're talking about the two biggest ticket items, or primarily the GHLI, but as far as the entities is concerned with regards to their federal grants, especially the ones that are 100% funded, what is the driving force behind them being asked to take austerity provision when they got their 100%? Can we just, because some of these agencies are obviously there are the frontliners, I know, but there's also, in my opinion, that there's also frontliners that are not being recognized as frontliners, and they are receiving federal funds.
So the policy behind the governor's directive to include federal programs in the austerity is so that they could use those lapsed funds from personnel and reprogram them to operations. What we've seen historically is that federal programs, some of them pay for their utilities, but not all of them. And so because the CNMI is in this current situation where even utilities is a hard obligation to pay, and we've asked all government agencies to transition to prepaid, we're asking that even federal programs pitch in with their sources of funds and help pay for the utilities that they are using within a government building.
Okay, thank you, Secretary, and again, we have to give them, credit, 100% credit for actually going out and being creative to finance their operations. And the only concern is some of these folks, some of these entities are shorthanded as far as manpower because of the call to remove all the vacant FTEs if they're funded under the general fund. So they abide by that, but when we do that and then you ask them further to cut on their federal funds, it's asking a little bit too much when they are required to respond 24/7 to a crisis. So I was reached out, and I want to inform you beforehand that we're really considering putting a provision in the revised budget to allow them to work through with what they have in terms of their program funds with the federal government, federal funds. So I just want to flag that so that when it does come down to the final product, you would, you're informed. Okay, that's all I have, Mr. Chairman. I think other than anything else, we're gonna.
Yeah.
I'll yield back.
Thank you, Chair, and then the Chair will now recognize the Vice. Perhaps the last questions before we move to adjourn.
Thank you, Chairman, and thank you guys again. I know it's been a long afternoon, but Secretary, just on the to piggyback on Senator Jude's question regarding the cut is so that they can utilize those funds towards operational expenses.
Yes, that has been communicated at our cabinet meetings multiple times to the expenditure authorities to seek other sources of funds, such as their federal programs, and how they can review their expenditures, whereas local funds were helping to support the program. And that assumption or policy came from the indirect costs, because if the indirect costs, the grant is charging the high rate at 32%, the assumption is that the local government agency is paying for the utilities. That was not the case. And so we took that policy and said, now the federal programs, you have to charge the lower rate, 7%, and pay your own utilities. So because that was not contemplated when the grant was routed, right, for funding, they have to go back and figure out how they can move funding around so that they can support their own program, because the CNMI can no longer support that assumption that we will be paying for their utilities. So yes, federal programs will be transitioning, or have been instructed to transition to the lower rate on the IDC.
Okay, well, so with the same assumption, how would this affect them in the future should we go back to 80 hours? Is the central government going to be able to afford that 12.5% reduction in the future to match their full salaries back at 80
For
hours?
federal programs?
For federal programs.
Oh, I would leave that to each federal program and the program managers to, again, review their budget and what they're able to fund, considering they have to now fund their utilities and their operations fully at the 7% IDC.
I do understand that at this period, no?
Mhm.
But in the future grant application or grant renewals, is it going to be affordable to get them back to their 80 hours?
That would depend on the funding level that they have from the grant. They would have to figure out how would they fund 80 hours on their personnel, but also have to fund their utilities. So I
we're
can't
just-
answer in general, because everybody's different in
It's
their
different,
grants.
right? So
Yeah.
let's take BECQ, for example. BECQ is 100% federally funded. The administration went into the position that they were going to be cut 12.5% or 10 hours. Their utilities paid for by their federal funds. Their rentals paid by their federal funds. But yet we're cutting their salaries by 10 hours. What's the logic behind that? There's zero savings, zero cost to the government, and they're already using their federal grant money to pay everything that you just brought up.
So this question has been asked in the cabinet meetings. And of course, the directive is not written just for one special program. It's written for across-the-board implementation. So again, in the cabinet meetings, we have advised expenditure authorities that now that you have the directive, apply it to your program, and then if you have extra funding available after you've covered A, B, C, and D, you have the opportunity to approach the governor, show him your expenditure plan, and request for an exemption, and that's the process that we have asked them. But in terms of the directive, it's applied across the board. So for example, BECQ, if that's the case, then they would be, of course, referred to the governor for his, only he can authorize an exemption.
But you also mentioned that only CRM has been granted. What about the
I did not mention
EQ?
CRM. I'm just saying in general,
Okay.
because this doesn't just apply to BECQ, it applies to anyone.
No, but you mentioned that CRM was one that was allowed to go back into 80 hours in the beginning of this conversation. With the directive of federal programs, you said that CRM was the one that's allowed to go back. What about the EQ portion of BECQ?
I don't see those exemptions until the governor signs it, and so I would say it just depends on who the expenditure authority is requesting exemption for, and if it's approved by the governor, and then we just comply with.
Yeah, but I mean,
yeah.
if the idea is to utilize their personal costs towards operations, right? And you know for a fact that BECQ is 100% federally funded. As we're using them as an example because it's easier, right? And they're already paying for rent and all of that stuff with the federal grants. Why even include them in this process?
Like I said, that's where the assumption is that the directive is made for across-the-board implementation, and if you find yourself already meeting all those requirements and you still have available funds to fund your employees, they have to go to the governor. I cannot allow the
Okay,
exemption.
I think we're gonna keep going back and forth on this, but those guys have already proven it's 100% zero cost to
And-
the
and they
government.
can
Matter
go
of
to the
fact,
governor
they have so
for-
much money they buy many toys, right? But so let's go back to the budget. On the current budget 24-14, there's a section there, a provision that states, and this was requested through the budget process by even OMB and finance, that the vacant positions that are in the process of being filled up shall be allowed to be filled up. There's a lot of departments and agencies that went through this process that have been contacting our offices regarding this revised budget because they're not allowing them now to fill those positions when the current law states that they're allowed to process those vacancies that were already in the process during the budget deliberation.
So, if you look at the, you know, the vacancies that were continuously included in how many years of appropriation, some of them have not filled those positions for over a year. And Rep. BJ, those positions, if they were not filled within the fiscal year that they were given and they operated their programs, then do you think they still need those positions?
No, not
Because
those.
they were vacant for, some of them are over 3 years. I think it's time that we look at, you know, those vacancies and put the funds where they are needed, rather than continue to allow them to keep those lapses and not fill the positions. So I think
And I
that's
agree.
one consideration
I
that must
agree
be
with-
given.
I agree with you, Ms. V, and that was an understanding that we had when we were talking about that those positions that were vacant for a period, that we would remove them. That's why we were able to move about $3 million from vacancies. But those positions that even your office had recommended that they're already in the process with I don't know, whatever the announcement was, and they're in the process of filling those vacancies that people had resigned from those positions, that we allowed those to go through, because the position of the legislature was actually to remove all vacancies. But the request of, even through your office, you saw that some of these are being processed, but some of them happened in October, and they said that they couldn't fill those positions because they've removed those positions in the revised budget. But the current law, as requested in those deliberations, allowed those positions to be filled, not those ones that were vacant for a year, 2 years, 3 years. We took that out with you guys' assistance to make sure that we actually take those out of the budget, so they're not included in the future budgets that were submitted. So I think, again, it's, why are those not allowed? I can talk about DPW is one example. They moved with those positions for accountant assistants or accountant ones for the division of solid waste, and they were stopped. But those are actually budgeted positions already at the request of that during our deliberation for the FY26 budget, to leave those open and budget them because they're in the process of filling those positions.
So there is a way around not having the general fund absorb, a particular position. If they have revolving funds, all they need to do is come up with a spending plan on how those revolving funds can be spent, and those can be, that particular position can be filled under the revolving fund, because there's that flexibility that's being given to all of the departments and agencies that have revolving funds, for the year.
And you're right, and that's a language that we agreed to include. But in the FY26 budget currently sits, those positions are fully funded, and we're blocking them from filling those positions when the request is to allow them to process because they're already in the process during the deliberation. And these guys are stuck now, and now we're going to tell them to use the revolving accounts. What if they don't have the revolving accounts to apply to those positions that we agreed to?
So the process normally would have to be submit a request to the governor, a great justification on why that position should be reinstated, and we come to the legislature, and the legislature can act on it by joint resolution.
That's the NOP though, but the funding source is there, and a directive will never supersede a law, right? That we can agree on. So the directive of no hiring or hiring freeze and no salary adjustments does not necessarily supersede that vacancy that has already been budgeted.
So if we look at the way the budget is now for how long, maybe over 10 years, it's a lump sum budgeting. Sure. Here's 10 FTEs, here's $1 million. We've given the departments and agencies that flexibility to hire the 10 FTEs within the $1 million, not to exceed it, because once that goes beyond the $1 million, that's deficit spending, and no one is authorized to deficit spend in the government.
And you're right, but when we remove those positions, then it'll be deficit spending because the NOP is still there. The financial obligation is removed, right? So, okay, quick final question: if we're gonna have to justify that, or the departments and agencies need to justify that to fill those positions to the government. After the submission of October 14 revised budget, was there any salary adjustments made by any entity that flow through your office or finance or even OPM?
Yes, there has been requests for salary adjustment, but we're working within the revised budget, not with the budget that has been passed by the legislature, which is Public Law 2414, because, like I said earlier, the price of government has changed. Those allocation under 2414 has changed. It went from 179 million to 158 million. There's a $21.3 million adjustment. So any FTEs filled or at the request of the department, it is our duty to ensure that those FTEs exist within the budget and that the funding is available.
Salary adjustments, though, like salary increases, those are, since the revised budget been submitted to the legislature, were there salary adjustments to upwards?
We take that into consideration when, after the submission to the governor and the governor approves the request, then that request is processed as long as it doesn't go outside of the revised budget that has been submitted to the legislature.
Okay, and I respect that, but the revised budget is not law yet, and then the directive also states that there's no salary adjustment increases and freeze in hiring. So how do we, as the legislative side, we're going to be receiving information that's technically inaccurate because we're respecting the directive, but we're also now we're hearing that there potentially are salary adjustments with the same directive that states that should be no salary increases within FY26.
At this point of where we are now, like I said, we're like just 11 working days before the second quarter rolls in. We really need that health insurance, for all of the subscribers that are members. And we need that for the government to operate.
I 100% agree with you, but just the question is related to the budget and to the directive of the governor, and I just want to make sure that we follow that directive and respect that directive signed by the governor. We can't. Now we're commingling this the group health life insurance because it's part of the budget, but that's a separate question to the directive and the salary increases. So, I mean, I guess it's easier to always go back and say that we need to pass it because of the group of life insurance, and that's 100% correct. But there was a directive that came out. There's an existing statute that allows for these vacant positions to be filled. A directive that says no more hiring, no salary adjustments. That's also not being followed and being followed at the same time. So I just want to end it at that. I respect the decision of the administration, and I'm respecting the directive, and I'm hopeful that the budget does not, or the revised budget does not have any salary adjustments after the October 14th submission from the administration. Thank you, Chairman.
Thank you, Vice. And I guess with that, last question from our Vice. The Chair wanted to extend our sincere appreciation to you, Ms. V, and Madam Secretary of Finance and your team for coming before this joint body. I know that most of the members have already left as they have other meetings to attend. I do also want to thank our LB staff who are still here, who assisted this joint committee. So with that, we now move on our next order of business. There happens to be none on new business. Item 6, there's none on item 7, miscellaneous. So we are now on item 8, our last item, adjournment, and the chair now adjourns this joint committee meeting. We are now adjourned.